Hello, my name is Cameron Brown, and I would like to welcome you to the mitigation of stress-related reactions during an incident. I will begin with a quote from Peter F. Drucker. Knowledge is information that changes something or somebody, either by becoming grounds for actions or by making an individual or an institution capable of different or effective action. I believe this quote applies to the mitigation of stress-related reactions during a disaster because the more knowledge that we have about ourselves and others helps us to be more resilient. The mitigation of stress-related reaction session will be broken into two modules. At the end of the first module, you should be able to define resiliency, identify the aspects of disaster work that produce stress, list and describe the stress-prone as well as the stress-resistant personality traits. At the close of the second module, you should be able to describe self-esteem and explain the role it plays in promoting and resolving stress during a disaster. Be able to recognize effective coping strategies and relaxation techniques that promote wellness. Suggest some local and national resources for ongoing application and support. When we are called to render aid during a disaster, what happens if we are required to work too hard, make too many quick decisions, work under extreme pressure with limited resources, with little or no rest? According to a 1996 study by Kaplan, Turner, Norman, and Stilson, quote, resiliency theory is based on the concept that there are protective factors such as personal, social, familial, institutional that enable individuals to maintain competent functioning in the face of major life stressors. An individual's resilience at any moment is calculated by the ratio between the presence of protective factors and the presence of hazardous circumstances, end quote. The Mayo Clinic identifies 6 aspects to strengthen resiliency. The first one is positivity. Regardless of the life stressor, when we are able to extract one positive feature out of each experience, we cope much better than if we just look at the negative. The second one is creative problem solving. Nurses are very skilled at critical thinking and creative problem solving. The third aspect is compassion and gratitude. We are richer when we appreciate our health, safety, and having our basic needs met, instead of focusing on the things that we don't have or that we wish that we had. Basically, it's counting our blessings. The fourth aspect is self-care. All of us should find ways to develop the behaviors and habits that enhance our health and satisfaction. The fifth aspect is humor. We should laugh and play some each day and celebrate our gifts and strengths. The sixth aspect is purpose in life. Believe in something bigger than yourself. Take time to cultivate life interest and supportive relationships outside the workplace. So next we'd like to shift to looking at stress. How do you personally define stress? What do you notice about yourself when you feel stressed? What do you notice about yourself behaviorally? What do you notice about yourself cognitively? How about emotionally, the physical reactions that you have? Spiritually? All things being considered, what would you say is the major cause of stress in your life? What aspects of this disaster, or maybe previous disasters, create the most distress? Can you identify what your physical, emotional, and spiritual needs are? Are these needs being met? What are your typical ways of coping with stress? In your profession, what programs or support systems have you found most useful or effective in the promotion of resilience? What additional programs or support systems would be beneficial and help you or your family to cope with the stress of this disaster? During a disaster, you may work with people with stress-prone or stress-resistant personality traits. As we strive to learn more about ourselves and others, being aware of these characteristics gives us a better perspective. Some of the type A characteristics are time urgency, polyphagia, or what we commonly call multitasking. Type A's can find they can be competitive in most everything that they do. They talk a little bit faster, sometimes too, in addition with the cadence, it can be maybe volume. The volume is a little bit louder. Sometimes they can exert manipulative control, and sometimes that they're viewed as being hyper-aggressive. Sometimes during conversations, type A's will often finish other sentences and oftentimes dominate conversations. The next type of personality is going to be the type D personality. And it's often called the psychocardiology or the behavioral cardiology. Because of the relationship between emotional stress, specifically anxiety and depression, and cardiac function. The next is codependent. The definition is there: a stress-prone personality with many traits that seem to increase the likelihood of perceived stress and the inability to cope effectively with it. Addictive in nature, based on the need to make others dependent to receive self-validation. And that was a quote by Brian Seward. What behaviors might one with codependency traits exhibit? How might a nurse's desire to win approval from others impact his or her ability to cope effectively during a disaster? Type A's might use intimidation and dominance to manipulate others. What might a codependent use to manipulate? Could they possibly use acts of generosity, self-sacrificing martyrdom, and perhaps perfectionism? Codependents might exhibit lack of emotional boundaries, have feelings of inadequacy, mistrust one's own perceptions, and depend upon others' validation of their work and perhaps their feelings as well. Another personality is helpless-hopeless. That can be based upon low self-esteem, might exhibit poor self-motivation, have that cognitive distortion, emotional dysfunction, can oftentimes become easily frustrated, and they can have a tendency to give up easily. Seligman describes people with this personality as those who have encountered repeated bouts of failure to the point where they give up on themselves in situations where they clearly have control. Now, we're going to look at the stress-resistant personalities. Those are the hardy personality, the survivor, a sensation seeker, or that type R, the risk taker. with a hardy personality, the personality traits that collectively seem to buffer against any type of stress are control, commitment, and challenge. With the commitment, we'll start with that first. That's commitment to oneself, one's profession, and one's family. This is feeling a sense of control over your reactions to events in your life, feeling empowered and not feeling victimized. Challenge, that's having the ability to see challenges as opportunities for growth. That with this challenge, it's not a barrier, you're not being stonewalled, but you're welcoming that challenge and say, kind of bring this opportunity on, and then I'm going to extract the positive out of it, and also I'm going to grow from this experience. Now, our survivor personality traits. This is defined as the traits that comprise a unique winning attitude to overcome adversity and challenges, no matter what the odds may be, so that one comes out the victor, not the victim. Al Siebert suggests that the survivor personality has mastered an integrative problem-solving ability with the use of biphasic left and right brain personality traits. Those include proud but humble, rebellious yet cooperative, and spiritual yet irreverent. The next for the hardy personalities, the sensation seeker, or that type R, the risk takers out there. And Seward says that this type of personality are courageous people who confront stress by calculating their risk in extreme situations and then proceeding with gusto. We hope that you have found this presentation informational and feel prepared to keep your family safe while working during a disaster. Thank you so much for your time, and please visit www.texasnurses.org/C4C for more resources and information.